statins are some of the most prescribed drugs in the world. But despite their popularity, there's a lot of confusion and misinformation out there. So today I'm busting 4 of the biggest myths about statins and revealing what your doctor might not be telling you. But before we go any further, let me say this loud and clear. I am not telling you to stop taking your statin medication. That can be dangerous, and it absolutely must be done under the supervision of your doctor or healthcare provider. And even then, it needs to be done slowly and strategically. I do prescribe statins, but in very specific situations. So keep listening. Now, myth number 1. If your cholesterol is high, you need a statin. Wrong. Most doctors still rely on outdated cholesterol testing, the kind that was developed back in 1963. It only looks at total cholesterol, HDL, LDL, and occasionally will also look at triglycerides. But it completely ignores the particle size of these cholesterol molecules, the number of particles, and most importantly, whether or not your cholesterol particles are oxidized. Now, the kind of testing that this is kind of like using a flip phone in the age of smartphones. We've got much better technology, so why aren't we using it? I use advanced lipid panels in my own practice, including NMR testing, which looks at all the cholesterol subtypes and particle sizes. And I also measure oxidized LDL and oxidized phospholipid ApoB. And without those measurements, quite frankly, it's meaningless, and I do mean meaningless, what your total cholesterol is, what your total LDL is. You've got to know whether your cholesterol is activated, whether it wants to stick to your blood vessel. And if it's not activated, if it's not interested in sticking to your blood vessels, then those numbers are quite meaningless. Now, if you want to learn more, check out episode 173 of my podcast with Johnny Bowden. We break all this down in detail. All right, myth number 2. Statins are the best way to protect your heart. Now, in my opinion, that's an incredible oversimplification. Now, we once thought that the reasons statins did appear to improve outcome in patients preventing coronary artery disease or preventing a recurrence of coronary artery disease, in other words, a new stroke, a new heart attack, a new bypass, a new stent, is that it appeared that the more statin drugs we use, the more we push down LDL, the results seem to get better. But that was before we realized that statin drugs are anti-inflammatory and that statin drugs block what are called toll-like receptors, TLRs, on the inside of your blood vessels that cause inflammation. And the more statins you took, the more you block toll-like receptors and the lower the inflammation went. Statins lower inflammation. And in certain patients, I use them for that purpose temporarily. As I tell my patients, and again, I will prescribe statins for someone who's just had a heart attack or has a new stent or I did bypass surgery on. If you break your leg, I'm going to put a cast on it. And you're not going to wear a cast the rest of your life. Once that bone heals, you don't need that cast anymore. So I will use statins to stop the inflammation that caused the problem in the first place. Once I teach you how to stop having inflammation, and that's through your gut, for the most part, we won't need those statins. Do I still use statins for certain patients? Yes, because quite frankly, we can still see that their leaky gut is there, that there's still inflammation, and statins are a piece of the tool to help us block inflammation, not necessarily to lower their LDL. Once I teach someone how to eat, And once we see that that gut wall barrier is intact and there's no longer any inflammation, quite frankly, in my practice, statins are rarely needed. You can lower inflammation and support your cardiovascular system in other ways. Polyphenol-rich foods, for instance, olive oil, omega-3s, targeted supplementation, and a low-carbohydrate diet to lower triglycerides. And that's all spelled out in all my books, so there's nothing that you need to hear more about there. Now, number 3, and this is maybe most important myth, statins are harmless. There are physicians who firmly believe that we ought to put statins in our water, much like we put fluoride in our water for tooth decay. Now, this one really worries me. Now, why? Many of us carry a gene that we inherited from our parents that makes a particularly nasty cholesterol molecule called lipoprotein little a. And you usually see it abbreviated LP parentheses small a. Now, it's incredibly atherogenic. In fact, people with strong family histories of heart disease usually carry LP little a. It also is one of the largest drivers of narrowing of the aortic valve, called aortic stenosis, which I operated on extensively. And it's the number one cause of what's called vascular dementia. That's different than Alzheimer's dementia. So it's a real bad actor. Now, for years, we've known, number one, that statins have not only no effect on lowering LPA, but here's the bad news. Statins almost always raise LP little a. And there's numerous studies in humans to show that. It's not just my opinion. This is published literature. Now, I've seen this firsthand in patients who've had bypasses and stents while taking high-dose statins. Their LP little a remains sky high. When we wean them off of their statins and start using niacin or niacinamide, then their LP levels drop. And we can track their activity of their LP little a, not just by measuring LP little a levels, but by using a test that I mentioned earlier called oxidized phospholipid ApoB. It's abbreviated OXPL-ApoB. It's an $8 test. Now, if your doctor is not testing for LP little a, they could be missing a real important issue that is modifiable. And the test for LP little a in itself is only $8. So please ask for that test and then work with your healthcare provider in lowering LP little a. It'll save your life. It'll save your aortic valve. It'll probably save your memory. Myth number 4, cholesterol causes heart disease. This is probably the biggest myth of them all. Now, what's the real cause of heart disease? I've said it before, I'll say it again. Inflammation. I'll give you an example. Dr. Michael DeBakey, who was one of the great fathers of heart surgery, of vascular surgery, always used to say that cholesterol has nothing to do with plaque formation. It's an innocent bystander that acts like a spackling compound when there is damage to blood vessels. Let's say there's a pothole in your blood vessel. Cholesterol is used to patch that crack or that pothole. If you continue to damage that blood vessel, then cholesterol adds another layer. And pretty soon you've got a mound of patch on that damaged area. And this is what changed my life with Big Ed, who reversed his inoperable coronary artery disease by changing his diet and taking some simple supplements from a health food. And it was one of the most remarkable things that proved that Dr. DeBakey was right. That cholesterol wasn't the troublemaker. Cholesterol was just doing its job of patching damage to blood vessels. So if you stop damaging blood vessels, if you stop the inflammatory process, then cholesterol is not the troublemaker. Now, Personally, I have never seen a patient with coronary artery disease without leaky gut or a leaky mouth. So in my practice, if you've got coronary artery disease or you want to prevent coronary artery disease, fix your gut. And that's what we do. So let me finally say this one more time. Do not stop taking your statin without speaking with your doctor. If you have heart disease, the answer is to fix your gut, fix your diet, and then, and only then, working with your physician, consider backing off on statins. And this must be done slowly, carefully, and only with the cooperation of your supervising physician or healthcare provider. But please, 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 do not rely on outdated tests or one-size-fits-all prescriptions. Get the full picture. Ask your doctor the right questions and take charge of your heart health.
More amazing episodes just like this one. Watch now.
Now, over time, this leads to damage and inflammation, causing your thyroid to function poorly and eventually, if it continues, giving up the ghost.